This is a resource that was put together by Physicians for Social Responsibility. Here is the URL for that resource. It was put together in the year 2000, but it's still a very, very good overall resource. So if it would be of interest to you or your physician or local clinic, I encourage folks to get this resource. Okay, so a little bit of 101. What are pesticides? Basically, chemicals designed to kill. That's the side. And the pest are many different things: plants, insects, rodents, fungi, etc. And thus, when we talk about pesticides, that includes all of them. If we're talking about herbicides, that's weeds, or insecticides, insects. And I say this because sometimes people confuse the two. They might be talking about a pesticide or an herbicide. Well, in fact, herbicide is a subset of pesticide. So due to their very nature, they can be hazardous to human health and the environment. Now, Emily already talked a little bit about organophosphate pesticides. Here are just some of the common groups of pesticides that you will run into. Organochlorines is the group that includes DDT, or lindane, which is actually a product still used on children's heads for the treatment of lice. Pyrethroids are commonly used in some home products. They're also used on pets and flea collars and whatnot. And triazines, for example, is the group of herbicides to which atrazine belongs. EPA estimates that 10 to 20,000 acute cases of poisoning occur every year, but most of these cases go unreported. They go unreported for a number of reasons. Workers don't have insurance, lack transportation, fear of retaliation and job loss are really important. Obviously, this is a focus on worker-reported poisonings, but another very, very important piece of this is also relevant to neighbors in agricultural areas, and that is the very last one, about physicians being unfamiliar with signs and symptoms of pesticide poisoning or about obligations to report or opportunities to report. And this is a point that I make with physicians as well, and that is that physicians typically in their training receive about 10 hours of training on environmental toxicants that may or may not include pesticides. So from no fault of their own, physicians often or simply do not know to look for pesticides as the cause of a problem. So that's why it's really important for individuals themselves, if they think that they're experiencing signs or symptoms of pesticide exposure, to tell the physician that. They might not know. Some of the acute effects of pesticide exposure you'll see in this slide: irritation of eyes, nose, throat, skin irritation, respiratory problems, headache, blurred vision, stomach cramps or vomiting. Many of these symptoms here are things that you wouldn't think are not necessarily related to pesticide exposure. In fact, they can and are often easily confused with other problems, flu or other ailments. So really what it takes for a physician to appropriately diagnose a pesticide exposure is looking at these symptoms plus taking an environmental history. Where were you? Were you working in the fields? Was there agricultural applications near you, etc. Talk a little bit about routes of exposure, who's exposed, and again remember that this presentation originally was designed to focus on worker exposure, but not exclusively. So the folks that are exposed include workers, but also and applicators. That's a group of workers, but also neighbors and consumers, as Emily mentioned. Exposure to pesticide residues on foods is in fact common. And folks are exposed through breathing pesticide drift, through exposure through eyes, ingesting pesticide residues from hands or food, ingestion of or contact with contaminated water, and skin contact with residues on plants, for example. Here's just a couple pictures. So upper left, you see, of course, the airplane. Obvious how that can be drifting off-site, especially depending on weather. But down on the bottom right, I'm sorry, upper left, bottom right, is an example of a field that has been tarped with plastic because it has been treated with soil fumigants. Soil fumigants are used throughout the U.S., and they are gaseous pesticides that are applied to the soil so that they will move through the soil profile and basically kill whatever's in there, including fungi, bacteria, insects, even weed seeds. So they're highly, highly toxic biocides, and methyl bromide in this particular article is one very commonly used soil fumigant. Agricultural workers are exposed in a number of activities, planting, weeding, thinning, etc. But also families of workers are exposed, or individuals who just live near agricultural fields. And the primary route of exposure for residents near agricultural fields is drift. In addition, as Emily mentioned, there can be exposure from contaminated clothing that's brought to the home. So that's why it's very, very important for people who work in or near fields that when they do come home from the fields, that they wash their clothes separately from the family's clothes, and they take their boots off outside and really do whatever they can to eliminate bringing those pesticides into the home. So these next few slides are very much directed towards the physician. So what I'll mention here is that the pesticides in bold, like chlorpyrifos and methomyl, are pesticides that are on the Kaua'i list of restricted use pesticides. Organophosphates are best known for their mode of action as inhibiting an important enzyme, nervous system enzyme. It can actually be measured. So people who have extraordinarily high exposure levels can get a blood test that will show reductions in the activity of this important nervous system enzyme. The symptoms in the lower part of this slide just show the kinds of symptoms that happen when you're exposed to organophosphates, and chlorpyrifos again is one that we've been mentioning. Vomiting, diarrhea, bronchoconstriction, etc. But many of these are not uncommon. So headache, weakness, confusion. Meiosis, a medical term, is pinpoint pupils, and that happens to be kind of a good giveaway for organophosphate exposure. And as I mentioned earlier, pyrethroids, common in household products. Here's a couple in the second bullet down that are actually 3 of them that also are on the Kaua'i list of restricted use pesticides, permethrin, cyfluthrin. And S-fenvalerate is actually a product, a component of Nix, which is a over-the-counter treatment for parasites that often is used for treatment in kids. And the symptoms down below, acute symptoms of exposure, are shown there for exposure to pyrethroid pesticides. Not to be confused with pyrethrins. Pyrethroids are a synthetic version of the pesticides that were originally derived from chrysanthemums, but they're a synthetic derivative and they're much more persistent. Acute poisoning dermatitis, another very common symptom or sign and symptom that occurs especially among workers. And here at the bottom, chemical burns are 2 pesticides on the Kaua'i list of restricted use pesticides, paraquat, the herbicide or weed killer that Emily mentioned, and methyl bromide, which I showed the picture of the field being tarped for the application of that fumigant pesticide. So to talk a little bit about fumigants, it's not a chemical class as some of the others, but it's the fumigant pesticides are considered together because the way they act and the way they're used. They're used in very, very high volumes because they have to penetrate the 3-dimensional soil profile. They're highly drift prone for the same reason, because they have to spread through the soil. They also are rapidly absorbed through lung membranes and through skin, and they're highly acutely toxic. both to respiratory systems, and they tend to be associated with severe rashes when directly exposed. This is really for the physician, but it's very, very important for us all to know this, that the only way to correctly diagnose acute pesticide-related illness is to maintain a high index of suspicion and to take a screening occupational and environmental history from any patient with symptoms that could be pesticide-related. This means for the patient that if you think your ailments are due to exposure to pesticides, you need to say so to the physician and let them know that you were near a treated field or you were working in a treated field. Because, as I said before, they might not know. They might not think to ask the right questions. So this, again, for physicians, is an excellent reference that shows them how to collect such an environmental and occupational history, but it's also a very, very useful desk reference for anybody. It shows the pesticides by category, and it shows what the signs and symptoms are, and you can actually carry this book or this reference to a physician if there's any doubt whatsoever that you might have been exposed to pesticide. And again, that's for acute pesticide poisoning as opposed to the chronic effects that Emily was talking about, and we can talk about a little bit more in a minute. So another important piece for physicians that I've mentioned is reporting. A lot of cases don't get reported. In many states, physicians aren't required to report, and that's something that can be legislated, and it's something that we have in California and has been very, very important, an important source of information for us to be able to understand the severity of the problem, the level of exposure among workers in particular. In California law, for example, any physician or surgeon who knows or has reasonable cause to believe that a patient is suffering from pesticide poisoning is obligated to report that. There are only a few other states that have that obligation. Hawaii is not one of them. But in Hawaii and other states that don't have this obligation, any pesticide-reported illness can be reported to poison control. And that's a number that anybody and everybody should have. Most poisonings among kids are accidental. They get into something in the household or that kind of thing. But it can also apply if you're near agricultural applications and you think you've been exposed. So what I've been just talking about is the acute exposures, and here we'll talk a little bit about some of the chronic or delayed effect or long-term effects of exposure. And some of the important questions with respect to can this pesticide or that pesticide be associated with chronic effects. Some of the important routes of exposure are through the placenta, prenatal exposure, or breast milk, postnatally. And then we want to know, well, are these chemicals reproductive toxicants or developmental toxicants, neurotoxicants, etc.? And I will show you later on with the resources one easy place to go to if you know a name of a chemical or a product to see whether they fall into any of these categories. And then, of course, the environmental history, where has the child been when mom is out working, or that kind of thing. Okay, chronic effects, adults and children. Even when we know the acute effects, it's important to consider possible chronic or long-term effects. And Emily talked in some detail about nervous system damage. There are some other important kinds of long-term damage, developmental problems. That's also something Emily touched upon. Hormone disruption, immune system damage is a very important one. Cancer, reproductive effects, birth defects, and asthma, as Emily also mentioned. Children under 6 represent more than 50% of cases of acute pesticide poisoning, and again, that's reported poisonings. Emily said why they are more exposed. The route of exposure is usually accidental, as I mentioned. And the other important thing to know about kids is that symptoms are likely to be atypical. Lethargy, seizures, they're not the kinds of things that you might see in adults. So that's also very, very important to know, and doctors might not know that. Some of the other reasons why children are particularly vulnerable, their nervous systems are just developing, greater rates of cell division, lower body weight. Those are some of the things that make them more vulnerable. They also have lower levels of key detoxifying enzymes. This one example here, peroxidase, is something that's very important in the detoxification of organophosphate pesticides. And children can have levels 10 orders of magnitude, I'm sorry, 2 orders of magnitude, like 100 times lower than adults. The range is quite large, but kids can have dramatically lower levels of these key enzymes. And fatality rates are much higher in children than adults from exposure to organophosphates. So what kinds of more protective public health policy can we and should we be pushing for? Pesticide use reporting is very, very important. It exists only in a few states, and I'll show you an example of the kind of information we can collect if growers are required to report their pesticide use, as is, for example, in California. We can ban or restrict pesticides. That happens periodically, not often enough. We can implement buffer zones or protection zones, which is zones that can't be, a zone or an area of, say, 100 feet or 500 feet between where a pesticide is allowed to be applied and a vulnerable site, a school, housing community, something like that. We can support safer pest management methods. Emily already talked basically about this precautionary approach to policy making, and the EU was one example, the European Union. So here's just an example of pesticide use reporting, and I say this because that's one of those things that exists somewhere. There's a precedent, and it's the kind of thing that a state, that a citizenry can push for. And here is a piece of California with the dark red being the higher level of use, the more intense level of pesticide use, and the pink being the lower level. And just what this allows us to do, this is on a county by county basis. It can be by pesticide or by group of pesticides or by crop or by month. And it allows us to find out where the most serious problems are and then target those for buffer zones or restrictions of pesticides or really pushing the alternatives. But this kind of information can be very, very powerful. And finally, the ultimate solution, of course, to agricultural use of pesticides is to not use them or to substantially reduce their use through various sustainable agriculture methods, organic just being one of them, but one that is growing in, fortunately, in popularity, which are based on such things as build and protect healthy soils, creating a system in which the plants are vigorous and resistant in their own right to pests and diseases. Part of that is maintain a diversity of crops and crop varieties so that it sort of thwarts the pests and diseases, so that there's actually a whole mix of different hosts and not just one huge meal there for the pests to thrive. And promote or support populations of beneficial insects like our very popular ladybug. So the next few slides are resources. I'll go through these really, really quickly. They're available online, but this is really directed towards healthcare providers. And you all have access to these, I believe, so you can look them up at your leisure. And again, I'm just going to sort of zip through some of these, because I understand that this audience is not primarily healthcare providers. Pediatric Environmental Health Toolkit, created by Physicians for Social Responsibility, is very, very interesting. Some of the PSR resources are made deliberately quite accessible to layfolk, even though they're designed for medical professionals. And finally, this is the PANS pesticide database. And this is a resource on our website that I mentioned earlier. If you have a chemical or a product, you can look it up online and you can get a whole list of the various um, health effects, whether it's acutely toxic, endocrine disruptor, groundwater contaminant, reproductive toxicant, etc. And you can also have information about reporting. So how and where to report. If you were to look that up in Hawaii, it would tell you, as I showed you, the Poison Control Center. And finally, just a thank you to my family for the support they give me in doing the work that I do. And with that, I will end.
Thank you so much, Margaret, and thank you again, Emily. We have so many questions, and so what I'd like you to do, Margaret, is we will stay on your screen, but if you could pull up the Pesticide Action Network info slides so that people can look at that maybe as you're answering a couple of questions. I'm going to go straight to the first question because we have many, and I do have to say we probably won't get to all of them. So what I'm going to suggest is the questions that we don't get to, I will send to Margaret and Emily, and they will create quick answers and any resources that are not already provided on these PowerPoints for you. So the first question is, which pesticides, chemicals have been found in our water here in Kauai, or here in Kauai generally? Have any of them been found in our air? I hear that the seed companies are claiming that all of the chemicals being found here have been found in very low and safe levels. Is this true? Now, I think, Emily and Margaret, that might be beyond purview of your research. I will start, as you can think about your answers, with the facts that we have been able to find just through public document polls that have taken about 6 months and many hundreds of dollars to obtain, as well as information that was obtained by the Waimea plaintiff's attorney that was shared by Kyle Smith, who is the plaintiff's attorney in the class action suit that is currently in progress. So in terms of the pesticides that have been found, there are restricted use pesticides which require training and licensing to apply. There are 22 that have been listed as restricted use pesticides used on this island. Several of them, I would say more than half of them, are listed on Pesticide Action Network's bad actor products used in the pesticide industry. What PAN calls a bad actor is the restricted use pesticides and other pesticides that are one of the following: either known or probable carcinogens, reproductive or developmental toxicants, cholinesterase inhibitors, known groundwater contaminants, or acutely toxic poisons. Among them are a number of names that I would not even try to pronounce, but they do include very familiar products such as Warrior 2, Mustang, Baythroid, atrazine, Magnum, Force 3G, Lumax, and permethrin. Margaret and Emily, I know that you have done some recent research. If you could just tell us what, say, the top 3 of those restricted use pesticides are, so that we have an idea of what we're dealing with.
I don't have the list in front of me of the restricted use pesticides in Kauai. I had the whole list, but I didn't have them in quantity. But what I did just do while you were talking, Phoebe, is I called up this, I believe my screen is showing, I called up the Pesticide Action Network's database to show, do you see that?
Yes.
Just to, okay, so I just showed, because you were mentioning it, so I put in chlorpyrifos. Maybe people saw the way I got to it, and it shows that actor, and it shows whether they fall into one or more of these particular categories. So any particular pesticide you can enter and put in here and find that result. So in terms of the list of the restricted use pesticides on Kauai, I don't actually have that in front of me.
That list is actually on a campaign website. It is on stoppoisoningparadise.org, and it is under the drop-down menu of facts. There is one called restricted use pesticides, and not only do you get a list of the pesticides, you also get a copy of the label, so you can read that. A recent study, recent as in about to be released, from PAN, which it will come out immediately after this call, will be released immediately after this call, is a finding that the top 3 RUPs, or restricted use pesticides, used on this island are chlorpyrifos, which you did talk about, atrazine, and paraquat.
So I just wanted to make a comment about the pesticides in water. I don't know. I actually just got some of the data that was collected on water testing. I do know that at Waimea Middle School, that atrazine was detected in a sample that was taken, I believe, a year ago. And atrazine is an herbicide, and also atrazine has been detected in several other water samples that have been taken around Kauai. So I think in this case, perhaps the companies have a different view of what might be harmful. Atrazine itself has been linked to endocrine disruption in frogs, in birds, in reptiles, and in mammals that are animal models, which is what we use for risk assessment in this basically. So atrazine is known to act on or be an endocrine disruptor at low doses, and the other thing that is really key is that it seems to feminize or demasculinize males depending on the level that it's exposed to. But all of these effects have been documented at low doses. And the other problem with atrazine is it is not possible to keep atrazine from running off into drinking water supplies. In fact, last year in the Midwest, a very large settlement, which really didn't address the true cost of atrazine runoff into the water, but a large class action suit was won by Midwest water companies that were suing Syngenta, the makers of atrazine, for the costs that they were incurring due to having to clean atrazine out from the drinking water supply. So this was actually a $105 million settlement, but it really didn't even begin to allow the water utilities to recoup the costs of what they were spending in order to filter atrazine out of the water, drinking water in Midwest communities. So I just wanted to let people know about that story. You can find it online. Just Google atrazine water settlement Midwest, and you will find news stories about the settlement and the subsequent payouts that went on to Midwest communities.
Thank you, Emily. The next question is there any way to tell if someone with moderate poisoning symptoms has been affected with pesticides?
Well, so there are a couple things here. One is that the environmental history is very, very important. The other thing is if it's a probable exposure to a probable acute exposure, then it's also important to know, were other people affected? That can be a very important piece of information. This is especially important if it's a crew of workers, but if it's a neighborhood or a family, and more people are experiencing the symptoms than just one, that's an important piece of information. And then looking at the set of symptoms with respect to what is in, for example, that EPA recognition and management booklet can give you an idea if it's pesticide exposure. So that's where a physician can help you out.
Okay, thank you. And another question, a lot of them having to do with water now. Where can we get our water tested? Or who is responsible for letting us know the safety of our water? And I will also bring in another question from another participant. What kind of filters can we use to clean our water?
Oh, Emily, can you answer that one?
Yes, I can. Sure. Well, first I'll take okay, so as far as filtering pesticides out of your water, there's a number of ways you could do it, but some people rely on reverse osmosis systems, but those are expensive. A lot of things can be filtered out just using a simple charcoal filter. So that would involve a Brita filter, something like a Brita filter that has activated charcoal in it, and that would allow for filtering out things like that. And there's also the NSF, which is, I believe that stands for the one I'm talking about is the National Sanitation Foundation. They have these different filters that they'll rate online. You could look it up and figure out what kind of filter you want to use for your water. But it is possible to filter it out at your home. And then as far as who's responsible, well, I think part of learning more about issues of pesticide runoff into your drinking water, a really powerful way to go about this is by letting the officials in your area know that you are really concerned about this. So I would say, talk to your local government. There's also opportunities at times if you, for instance, at PAN, where atrazine is up for a comment period, and we're, at times we we ask people to sign on to petitions and sign on and make your voices heard to the EPA that, citizens are concerned in general about pesticide runoff into their drinking water. But I think the local bill that's coming up right now, that would be a really key time to show what the issues you're invested in are. And then I don't know if Margaret had any other comments to make in response.
That sounds good.
Thank you.
Okay, thank you very much. One last question, and I will ask, it is going to be 5 o'clock in a very short, in a few seconds. I would like to see if the presenters would be willing to stay for another 5 to 10 minutes to answer a couple other questions. This is a very, very robust conversation. There are many people that have questions. So I would ask whether that is possible, and if not, we can take the conversation offline and we can continue this through email.
No, that's fine. It's fine for me.
Okay, Emily, is that okay with you?
Yeah.
Okay, great.
Yes, that's fine.
The next question is, what can we do here now, given that the major users of contaminants do not have to report what they are using, even when they are testing Agent Orange ready corn? And I will make a slight correction to that question. It is 2,4-D. So although they say it is not Agent Orange, that they only use 2 active ingredients. So the big question there really seems to be, what can we do here, given that we don't have the information on these pesticides as of yet?
Well, I would point to your campaign and what you all have identified as a feasible target and outcome, the bill that you've been pushing through the local legislature, no?
Okay, we can talk about that at the end of the call. I would like to share some information about Bill 2491. I would like to ask a couple more questions so that we make best use of our time with you. What is stacking is the next question. It says, what is stacking? I hear that some of the pesticides and restricted use pesticides are being used simultaneously or in combination. How does that work within what you've shared with us today?
I can say something that maybe Emily would add. So pesticides are rarely used just one at a time. In any cropping operation, often it's mixes of pesticides, or if at one moment it's one pesticide, then next week later it might be something else. Virtually all of the information we have about health effects of exposure to pesticides is on a pesticide by pesticide basis. There's very, very little information we have about exposure to multiple pesticides, which in fact is the reality. Plus, if you look at that website, the PAN website, I had it up there for a minute and you saw a lot of question marks under some of the health effects categories. That means that even those individual pesticides, many of them have not adequately been studied. So there's a whole lot we still don't know yet a lot of them are being used. But to answer the question about stack, it's not uncommon at all for us to be exposed to multiple pesticides.
Okay, thank you. The next question is, are there chemical testing sites where pesticide levels in blood or urine can be measured in the US or Canada? And this particular question was focused on finding glyphosate levels, but there are other questions here about general chemical testing sites.
Emily, do you have a response or?
Could you repeat the question? I'm sorry.
Are there chemical testing sites where pesticide levels in the blood or urine can be measured in the US or Canada? There was a particular interest in finding out about measuring glyphosate levels, but there are several questions about testing chemical presence of pesticides generally.
I see.
Actually,
Oh.
I will say something and then pass it on to Emily. One test for organophosphate exposure is very common. Other than that, there aren't that many labs that do the testing, but one good source is the Centers for Disease Control. Every 2 years puts out a big report about environmental toxicants in blood and urine, and there's always a big group of those that are pesticides. And that's an indication of some of the pesticides for which there are analyses, and we know that the CDC can do those tests. And there are a few labs out there, but not that many. So Emily, do you want to add to that?
Yeah, that's a good answer. And also, I'm not sure actually if the data we're talking about is exactly the same, but the National Institute of Environmental Health Sciences also publishes data on chemical exposures and what they monitor in the U.S. population. Sometimes there's issues, for instance, in the case of atrazine. I believe a few years ago, atrazine was measured in people in the U.S., but the thing they analyzed was something that actually is only present for about 24 hours, and there's 10 or 11 other chemical breakdown products from atrazine that are disposed of from the body that actually would have been better markers of exposure. So somehow a mistake was made in the analysis, since nothing has been done since then to really improve on that flawed example, of atrazine monitoring. And then the other thing I'd like to say is that glyphosate is supposed to be very difficult to test for and rather expensive. That doesn't mean it shouldn't be done, but I don't think there's currently any data on glyphosate exposure in the U.S. population. But we do know that it is very common in water runoff and surface water runoff.
Thank you very much.
As an example, if one looks at the PAN website and looks for chemical trespass, you'll see a report that we put together of the CDC data on chemicals in people's bodies, on pesticides in people's bodies, as an example.
Okay, thank you very much. In the interest of time, we do have a few other questions, and I will send them over to Margaret and Emily, and you will have your answer sent straight to your inbox. In terms of just an update on Bill 2491, I will let people know that there is a public hearing this Wednesday at July 31st, starting at 1:30. If you are interested in delivering testimony, please go sign up, and it will be a considerable wait, but you will probably get an estimate about what time it is that you will be able to deliver your testimony. At the very least, if you are not able to do that, please send in your testimony. The county council members are sifting through their thousands and thousands of letters, because a lot of letters are coming in from the mainland and internationally. The Kaua'i County council members care only about Kauai right now. They are sifting through, looking for people that they know, looking for names that sound familiar, looking for Kauai zip codes. That is what they care about to make their decision. So your testimony counts. Your friends on Kauai's testimony counts. Parents' testimonies count. doctors' testimonies count, teachers' testimonies count. So please, counsel testimony at kauai.gov. You can also go on to the campaign website, which is stoppoisoningparadise.org. That will give you not only lists and information about pesticide use specifically on Kauai, but also all kinds of links to flyers, brochures, fact sheets, everything that you could possibly want to spread the word, and most important, spread learning. We really care that this bill is not only something to pass, but a teaching moment for our whole island. There is no reason for our worker community and for those who say that this is my job on the line not to also care about the kinds of issues that we've talked about today, because they also have families and children. And we have to create that message that we are in this together and we will win this together. The hearing is going to be at 1:30 at the Veterans Building on Rice Street. Again, that information is on stoppoisoningparadise.org. I will also announce that immediately after this call, a Pesticide Action Network breaking report, a release on pesticide use and current pesticide information on Kauai, will be sent to thousands of people on our lists. I will also let you know that this call, because there are so many people that have had group viewings, this call has been listened to by about 200 people in some people's estimation. So the word is getting out, the knowledge is being spread. I was just given another comment from somebody very astute. Thank you very much. The public hearing is not at Rice Street. It is on Kapule Highway, which is close to Vedina Stadium, but not in it. So please take note of that. So on behalf of the Pass the Bill campaign and Pesticide Action Network, I thank you all for attending. Please keep up the good work. This session will be taped, and we will try to send it out to our networks as a QuickTime file. We will also look into the possibilities of it being shown on public television, Olelo television, if that is okay with Pesticide Action Network, and we will discuss that offline. But thank you so much, and we will see you Wednesday. This webinar is now concluded. Thank you all.
Thank you.